So a typical day in the life of a medical student would consist of getting to the hospital a little bit earlier than when you're meant to start to find some scrubs and know where you're going, and then find your way to the ward you're at. So, for example, I was on my obs and gynae block, so I wore my scrubs and then turned up and took some histories from the women who were expecting babies and going in for a C-section, which is very exciting. And then you just want to get consent and kind of get permission to be in the room when they're giving birth. And then you kind of might help assist or maybe hold some equipment and help in that way, and also kind of play a role of reassuring the parents while the doctors are busy doing the kind of more important things. You might want to just talk and make conversation and things like that. And then you would kind of have lunch at 1 p.m. when all the team kind of splits off, and then come back and maybe spend some time on the wards and seeing, maybe like on the postnatal wards, and seeing the kind of afterwards of when all the babies are there. And maybe some of the other things we do as medical students is take bloods, like we've been teaching this morning, but of course on real patients, and also things like urine dips and other clinical skills that you might practice that we see a lot on obs and gynae particularly. So days vary when you end, because the hospital kind of, every professional has a different shift time, but as a medical student you wouldn't be expected for longer than 9 to 5. So around 5 o'clock your day would wrap up, unless there's kind of like a emergency C-section or something that you want to stay for. That's completely up to you. And then you've got the evening to yourself, just to kind of unwind and maybe get some work done before the next day. Usually we like to read up on what we've seen in that day, just so you kind of can learn a bit more about what's been going on.